Welcome to Iswam Virtual 2021.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Selamat pagi, Om Swastiastu, Namo Buddhayo, Salam Kebajikan. Good morning. Hi everybody, I'm Kishanty from Indonesia. I'm so grateful being well and happy to be able to meet you all at this event virtually. And for my dear colleagues, everywhere you are, thank you for being here with us today. It's my pleasure to welcome you all in this session. And together we will explore an update and knowledge related to aesthetic medicine. And this session will be discussed of the real cell therapy in aesthetic. And as usual, the session will be divided into topics. The first topic will cover some important points of the action of the cell regenerating factors such as pdrn, MGF, and others by Dr. Young Kim from South Korea. And the second topic is properties and techniques of polynucleotide injection treatments for global skin quality improvement by Dr. Michael Kim, also from South Korea. And for the participant, please don't be hesitant to ask anything through the live chat box during the session, and our speaker will answer your question at the end of their presentation. Now, before I start first topic, I will briefly introduce our speaker today with warm welcome. Here with us, Dr. Young Kim. Are you there?
Hi.
Hi. We are already familiar for us. Besides being expert in his field, we know that he can also singing. Good morning, Dr. Kim.
Yeah. Good morning. Yeah.
How are you?
I'm good. And how are you?
Yeah, you look great as always.
Yeah.
January is coolest month in Seoul, right?
Yes, it's really, really cold.
Chill,
it's about minus 15 degrees Celsius.
Oh.
How about there?
It's a rainy season.
Rainy season.
Yeah.
Okay, yeah.
It's almost rain every day.
Mm-hmm. Yeah.
Yeah. Okay.
I really miss the Indonesia and Jakarta.
Of course,
I really want to go there. Yeah.
Yeah.
Because of coronavirus pandemic, yeah, I cannot go there now.
I hope it will be over soon. We hope so. Yes.
Yeah, I hope so.
Okay. And now, to know more about Dr. Young Kim, we will share his curriculum vitae.
Excuse me?
I will share your CV. It's screen.
CV. Okay.
Dr. Young Kim graduated from Korea University Medical College as bachelor degree, and his career at 2008 to 2009 in Korea University Medical Center internship at Few Plastic Surgery Hospital in Seoul from 2012 until now. It's the one of most plastic surgery hospital popular in Seoul, right? Dr. Young Kim will present the topic about the action of the cell regenerating factor such as pdrn, MGF, and others. And after that, we can see the live demo how Dr. Young Kim do injection to patient. Okay, without further ado, please welcome Dr. Young Kim. May you start your presentations, please.
Can I start now?
Time time is yours. Yes, may you play your video.
Hello everyone. Before I start my lecture, I would like to thank the Iswam committee for inviting me as a speaker again. It is my great honor to be able to speak at this year's virtual Iswam 2021. Today, I'm going to talk about cell therapy. Before I begin, I need to let you all know that my mother tongue is Korean and not English. Also, I have never lived in any English-speaking countries, so my English is not very fluent. I believe that most of audience are not from English-speaking countries as well. So, I will try to use simple expressions and try not to speak too fast. I appreciate your cooperation in advance. Okay, now let's start. The title of my lecture is The Actions of the Cell Regeneration Factors, pdrn, MGF, and others. Today, I'm going to tell you what components our skin consists of and how they regulate skin regeneration. Before we talk about cell regeneration, let me briefly introduce myself. My name is Young Kim and I'm an aesthetic doctor from South Korea. I take care of patients not only in Korea but also in China. I have been giving lectures to doctors from many countries including Vietnam and Indonesia. And I have been a speaker here at Iswam since 2018. And I'm also one of the writers of the book titled Skin Rejuvenation, which was published by Derma, the largest medical aesthetic society. The president of Iswam, Dr. Tegu, and Dr. Inigo, who is a doctor from Spain, are my good friends. We held a very good conference on thread lifting in Bali last year. These pictures are from when I was working in China. I sometimes sing a song for my Chinese patients, and I hope to have a chance to sing a song for you all someday. And I believe that many of the audience members who are listening to my lecture now know who I am, and that you might wonder how my life is right now. So I would like to let you know my news. I have just gotten married. The marriage happened just 2 months ago on November 15th. It was a miracle to be able to hold a wedding ceremony during the coronavirus pandemic. Although I was unable to invite many people to my wedding ceremony because of coronavirus, it was still a very happy moment for me. In the center of these pictures, my wife and I wear hanbok, which is Korean traditional clothing. Isn't it pretty? And this is my wedding ceremony picture. The singer and MCs are both famous people in Korea. I want to show you a short video of my wedding march. Let's watch it together.
드리겠습니다. 자, 신랑 입장!
Also, my wife just started Instagram, so please follow her and communicate with each other. And this is my email. I rarely use Instagram, so if you have any questions about academic or personal topics or anything, just email me at this email address. Okay, I think I've told you enough about my personal life. Let's begin studying now. Today, I'm going to talk about cell therapy. But before we talk about cell therapy, we should know how our organ, the skin, is organized. Skin is the organ that covers outside of our body. And skin is divided into epidermis and dermis. Both epidermis and dermis are composed of their specific cells and extracellular matrix. Dermis itself is divided into papillodermis and reticulodermis. The main cell of epidermis is called keratinocytes, and the main cell of dermis is called fibroblasts. The cell is the functional and structural basic unit of living things. The cell is composed of many components, for example, mitochondria, ribosome, and so on. But the most important part of the cell is the nucleus, because the nucleus contains DNA that carries genetic information for the development, functioning, growth, and reproduction of all living things. In this speech, we are going to talk about what's happening at the cell level, so I will focus on the things that were just mentioned. Let's start with epidermis and keratinocytes. This is the cross-section of epidermis. Epidermis, the outermost layer of our body, is mostly made of the cell called keratinocyte. The most important role of epidermis is forming a barrier. They protect our body from heat and ultraviolet radiation, water loss, infections caused by bacteria, viruses, parasites, and so on. The differentiation of keratinocytes starts from basal layer, which is called stratum basale. It is the lowest level of epidermis and is the border between the epidermis and dermis. Keratinocytes differentiate and migrate toward the surface of the epidermis, and they finally become corneocytes, which are keratinocytes that have completed their differentiation progress and have lost their nucleus and cytoplasm. Technically, they are dead cells. Corneocytes will eventually leave our body through desquamation as new one comes in. In humans, keratinocytes turnover cell cycle from stem cells to desquamation is about 1 month. That's why we undergo the ablative procedure every once in a month. Although corneocytes are dead cells, they play the most important role in the protection for the epidermis. Some people like to remove their dead skin cells because they think they are cleaning themselves. However, they are wrong. We should let them be removed naturally and not when we want. Please don't remove your dead skin cells. If you are annoyed by your peeling skin, just know that the peeling skin is a sign that your skin is dehydrated, so just keep applying hydration cream. Don't remove your dead skin cells. And I need to tell you about one more cell in epidermis called melanocytes. They are located in basal layer, and about 5 to 10% of cell in basal layer are melanocytes. Their main role is producing pigments, which are called melanin. Our skin color is decided due to the quantity of melanin. The main role of melanin is to protect our cells from UV radiation. On the other hand, most pigmentation diseases are related with the melanin, like PIH, melasma, and so on. Now let's talk about dermis and fibroblast. Dermis primarily consists of dense, irregular connective tissue, and the main role of dermis is to protect the body from stress and strain. It is divided into papillary dermis and reticular dermis. Papillary dermis is the upper part of dermis which is connected to the epidermis. It is named because of its shape, and it is composed of loose areolar connective tissue. One of the main functions of the dermis is to support the epidermis. They exchange oxygen, nutrients, and waste product between epidermis and papillary dermis. The papillary dermis is more productive than reticular dermis. On the other hand, the lower level of the dermis, the reticular dermis, is composed of dense, irregular connective tissue. The reticular region is usually much thicker than the papillary dermis. It receives its name from the dense concentration of collagenous, elastic, and reticular fibers. These protein fibers give dermis its strength and elasticity. Within the reticular region are the roots of the hair, sebaceous gland, sweat gland, and blood vessels. The collagen fiber, glycosaminoglycans, reticular and elastic fiber in dermis are made by fibroblasts. To summarize, the most important role of the skin is protection against the external threatening factors. Keratinocytes, a major cell of epidermis, becomes corneocytes to make barrier. Dermis primarily consists of connective tissues, and they are made by fibroblasts. Next subject is DNA. DNA stands for deoxyribonucleic acid, and nucleic acid means polymer of nucleotide, polynucleotide. Nucleotide, the basic unit of nucleic acid, consists of phosphate, pentose, and a nucleic base. Because of the nucleic base, each nucleotide has its own specific feature. DNA is located in the nucleus in a coiled form. DNA carries genetic information and synthesizes protein through transcription. I have prepared a video which explains the process of DNA transcription. Let's watch it together.
Here is a cell, the basic unit of all living tissue. In most human cells, there is a structure called the nucleus. The nucleus contains the genome. In humans, the genome is split between 23 pairs of chromosomes. Each chromosome contains a long strand of DNA, tightly packaged around proteins called histones. Within the DNA are sections called genes. These genes contain the instructions for making proteins. When a gene is switched on, an enzyme called RNA polymerase attaches to the start of the gene. It moves along the DNA, making a strand of messenger RNA out of free bases in the nucleus. The DNA code determines the order in which the free bases are added to the messenger RNA. This process is called transcription. Before the messenger RNA can be used as a template for the production of proteins, it needs to be processed. This involves removing and adding sections of RNA. The messenger RNA then moves out of the nucleus into the cytoplasm. Protein factories in the cytoplasm, called ribosomes, bind to the messenger RNA. The ribosome reads the code in the messenger RNA to produce a chain made up of amino acids. There are 20 different types of amino acid. Transfer RNA molecules carry the amino acids to the ribosome. The messenger RNA is read 3 bases at a time. As each triplet is read, a transfer RNA delivers the corresponding amino acid. This is added to a growing chain of amino acids. Once the last amino acid has been added, the chain folds into a complex 3D shape to form the protein.
Due to some causes, including ultraviolet radiation or infection, DNA could be damaged. When DNA is damaged, the sequence of its nucleic base could be changed. And because of this damage, DNA could carry wrong information or synthesize wrong proteins. We call this change mutation. Up until now, we have learned how our skin is organized and the functions of the cells of our skin and its DNA. From this point, we will look into how cell-degenerating factors act on these cells and DNA to make our skin healthier. There are many different cell-degenerating factors. However, today, I'll speak on pdrn, MGF, adenosine, and niacinamide. PDRN stands for polydeoxyribonucleotide, and MGF stands for multi-growth factor. EGF, VEGF, IGF, TGF, KGF, FGF all belong to MGF. We will learn about MGF first. Before we talk about MGF, let's take a look at what each of its parts stands for. EGF is epidermal growth factor. VEGF is vascular endothelial growth factor. IGF is insulin-like growth factor. TGF is transforming growth factor. FGF is fibroblast growth factor. KGF is keratinocyte growth factor. And now let's briefly look into their features. First of all the growth factors are cell signaling proteins. Each growth factor has its own family or subtype, and each one has its corresponding receptor on the cell surface. All of the growth factors stimulate cell growth and differentiation. But, as the name suggests, each growth factor is specialized for their own job. For example, VEGF plays an important role in vasculogenesis and angiogenesis. EGF stimulates growth of epidermal and epithelial cells. However, this does not mean that each growth factor only plays its specific role. For example, FGF1 and FGF2 are more potent angiogenic factor than vascular endothelial growth factor, VEGF. The next one is PDRN. PDRN stands for polydeoxyribonucleotide. We talked about nucleotide when we talked about DNA. PDRN is a fragment of DNA from salmon's sperm. Then why salmon? Because salmon's DNA almost matches up to human DNA, and it doesn't create any problems when it is introduced to the human body. Also, salmon's sperm contains plenty of nucleic acid. Then, how does PDRN regenerate cells? Well, there are two ways. The first way is by acting on adenosine A2 receptors, and the second way is by salvage pathway. Here is what happens when PDRN acts on adenosine A2 receptors. First, PDRN has an anti-inflammatory effect by regulating cytokines. Second, PDRN increases growth factors like EGF, FGF, and IGF. And third, PDRN improves microcirculation by angiogenesis stimulated by VEGF. As I stated before, PDRN is a fragment of DNA. When this fragment regenerates a salvage pathway, DNA synthesis is stimulated. Now, we will look into adenosine and niacinamide. In the PDRN portion of this lecture, I told you what happens when adenosine receptor is activated. Activating salvage pathway, anti-inflammatory action, and increasing growth factor. For niacinamide, it is actually not a cell-degenerating factor, but rather it is a whitening agent. It is also known as vitamin B3 or nicotinic acid. Niacinamide have a whitening effect by inhibiting melanin from reaching the surface of the skin. Even though it is not a cell-degenerating factor, I wanted to introduce it to you because many people want to make their skin whiter. Because of their high molecular weight, these cell-degenerating materials are unable to penetrate the skin barrier. So, we need to make channels for them to penetrate our skin. I prefer to use MTS, microneedle therapy system, because it's cheap, easy, and effective, and there is no downtime when using this method. And MTS can give the skin mechanical stimulation. When you use MTS, depth is very important. Target depth should be the basal layer, dermal-epidermal junction. Here are my reasons. Number 1, I want to influence both the keratinocyte in epidermis and the fibroblast in dermis, especially papillary dermis. Number 2, if you stab the skin too deep, your patient may start bleeding, and then the blood will push out the ingredients. Therefore, do your best not to have your patient bleed. I use 3 kinds of ampules, and I choose the ampule according to the condition of the patient. Every ampule has the same procedure schedule. When I start a patient's treatment, I do it once in a week for 5 weeks. And after 5 sessions, I do it once in a month for maintaining. If your patient has many problems like wrinkles, lack of elasticity, and especially inflammation with acne, I recommend you choose Dr. Inordum 1% pdrn ampule. This is because pdrn has an anti-inflammatory effect, and it is also able to activate all regenerating process. And if your patient wants to focus on rejuvenating, I recommend you to use Rejuvenating Live MGF. It contains EGF, VEGF, IGF, TGF, KGF, FGF, and more importantly, adenosine. Adenosine will help activate adenosine receptors to regenerate the cells. If your patient wants to focus on whitening, I recommend you to use Whitening Live MGF. It contains not only the 6 kinds of MGF that I mentioned previously, but also niacinamide. Niacinamide will help inhibit melanin from reaching the surface of the skin, so your patient's skin will gradually become whiter. Thank you for listening. Once this lecture is finished, I will be doing some live demonstration and Q&A at the same time together at your Q&A session. and I have prepared a quiz for you all. If you answer these questions correctly, I'll send you a gift. Question number 1. The most important role of skin is something against the external threatening factors. Question number 2. Something, a major cell of epidermis, becomes corneocyte to make barrier. Question number 3. Dermis primarily consists of connective tissue and they are made by something. This something is also a kind of cell. If you know the right answers and want to win a gift, please do the followings. Number 1, follow MISO0518 Instagram. And number 2, send the answer through direct message. And number 3, write a reply done on the quiz page. And number 4, drawing for the winner will be on Sunday, it's 10th of January at 10 o'clock Jakarta time, 10 a.m. on MISO 0518 Instagram. First place will receive Dr. Inoderm 1% pdrn ampoules. Second place will receive Dr. Inoderm Live MGF rejuvenating ampoules. Third place will receive Dr. Inoderm Live MGF whitening ampoules. If you are a winner, your gift will be sent to you by mail delivery service. Again, thank you for listening and see you at our live Q&A and demonstration.
Thank you, Dr. Young Kim. Thank you for your also effort by make the subtitle below the video. It's not done yet. Hello, Dr. Young Kim, are you there? Now for the participant, don't be hesitate to put your question in the live chat in the right of the screen, and we will deliver to Dr. Young Kim to answer the question.
Can you hear me now?
Yes. Yes,
Okay,
clearly. Yeah. Okay.
Yeah,
Thank you.
I'm preparing a song for
Oh.
Indonesian audience.
Yes.
It takes about 1 minute.
It's my pleasure. Thank you.
Yeah.
We can wait.
Oh Tuhan, ku cinta dia, ku sayang dia, rindu dia, inginkan dia. Untuk kalah rasa cinta di hatiku, hanya padanya, untuk dia. Terima kasih.
Oh, it's a big applause.
Yeah.
Thank you. It's a good song.
And I forgot to say hello in Indonesian. I practiced it. Selamat siang. Saya senang bertemu dengan Anda sekalian lagi.
Selamat siang. Senang bertemu lagi juga dengan Anda, Dr. Young Kim.
Yes. Thank you. And I'm prepared. I'm ready to do some live demonstration.
Yes.
And while I'm doing a live demonstration, you can ask me the question.
Okay.
I'm gonna do it simultaneously.
You prepare your demo. Okay.
Yes. And
It's so nice and clear presentation and refreshing for the basic knowledge of the skin and DNA, also the growth factors. Thank you, Dr. Kim. We have no question yet in the box, so I just want to ask you, how about the idea to accelerate the cell growth from the basal cell to surface by skin resurfacing or light peeling before we do the growth factor or
wait,
the
I'm sorry.
microneedling?
Wait a minute, please. 지금 한국 뭐 틀어놓고 이렇게 한국 뭐 소리가 들려요. 지금 끊어주세요. 다. I couldn't hear your.
Okay, now you can hear me.
Yeah.
Okay.
Now I can hear you. Yes.
Yes.
Can you ask me again?
Yeah.
I'm sorry.
It's okay. I'm just asking you, how about the idea to do the skin resurfacing before you do the growth factor, microneedling, like
resurfacing?
like light chemical peeling or peeling. It's the idea to accelerate the growth of cells. How can
I think I think it's a good idea. I think it's a good idea because the peeling is the process that remove the barrier of the skin, so it will help the penetrating the skin regenerating factors. So I think it's a good idea, and I also use that method instead of MTS.
Oh yeah, yes, according to your presentation previously about don't remove the dead skin and like that, it's a kind of the daily routine or just.
Yeah, I meant that sometimes they remove their dead skin like with a mechanical way.
Oh.
Yeah. So it's a very bad habit.
Oh, in the daily routine of patient, not in office, not in clinic.
Yes.
If we do in the clinic, I mean, like dermabrasion or skin laser facing, like laser, it's okay.
Yeah, it's good for skin.
Okay.
To make your skin better.
Okay, I get it.
Yeah.
So you can start your demo and
yeah.
maybe
Let's watch our patient first. He has some pimples and acne. Have some acne, right? And because of acne, I'm gonna use pdrn because pdrn has anti-inflammatory effect. So I'm gonna use MTS roller. Wear the glove. 이걸 굳이 이걸로 생각대로 안 하고 그냥 손으로 잡아서 롤러랑 PDRN. I'm gonna use only depth of this needle is only 0.25 millimeter. It's not deep. It's not deep.
superficially.
Yeah, superficially because
the target is the epidermal junction.
Junction, right? Yeah,
okay.
Yeah. Our epidermis is only 0.1 millimeter, so it's not very thick. So we don't need to use a very deep needle. And I spread it first. And to help penetrating, flowing the MTS. But at the acne region, the skin become very thin because of the inflammation. So you can make bleeding at this point. But try not to make bleeding. If you make bleeding, that means too deep. And if you have more questions, you can ask me while I'm doing live demonstration.
Yes. Is there the acne, active acne? You hit it with roller or just passing?
Hit the roller.
Oh.
Yeah, but you can make bleeding because of its inflammation.
Mm-hmm.
Skin become very thinner than other place.
And how the precaution is like nodules or the active acne, the redness is it safe to do that?
Yes, because if you rolling on that inflammation area, you can make a hole. You can make a channel for the exits of the bad cytokines or inflammation things. And how do you think?
Yes, it's quite easy and it's not need anesthesia, topical anesthesia before the procedure,
I
right?
already put some anesthetic cream before 30 minutes. But if your patient's skin is thick, you can use 0.5 millimeter roller.
Mm-hmm. Some participant ask, Dr. Kim, is it better to use MTS or intradermal injection for PTRN?
I think intradermal injection, because many skin booster is not allowed to inject. So
Mm-hmm.
If you use not allowed one, don't inject that material into the skin because it's illegal.
It's and with your preparation you do right now, it's not allowed to inject the intradermal. Just
Yes.
okay.
I think most of skin booster is not allowed to inject directly.
Another question from Dr. Mary. Can it be used for a patient with atrophy scar? If it can,
Atrophy.
how it uses? Okay.
Atrophy scar.
Can. Yeah.
You can use. You mean? I think it's kind of I think question is you can use this materials to the acne scar, right? Acne
Yes,
atrophy
yeah,
scar, right? Yeah, you can use it, but if you want to make if you want to make it growth, make it better, you better use deep deep roller, like
Oh.
a 1.0 millimeter roller, or you can use fractional CO2 razor together.
Mhm. It's combined to the mesotherapy.
Yes, yes, yes.
Yes.
And if you want to make a atrophy scar better, I recommend you use ablative laser first, and
Mhm.
next use regenerating factors like pdrn or MTS.
Immediately after with needle
Yeah,
or
immediate.
just
Yeah,
topically?
yes. Because
With needles.
because if
Pardon me?
you use ablative laser, that
Mhm.
means you break the barrier,
Mhm.
so it will help penetrating.
I see.
Yeah.
It's another question. Dr. Carol asked, is there any contraindication to perform PDRN with MTS? Contraindication, doctor?
Contraindication.
Mm-hmm.
I think there's no contraindication because you can use any type of skin, but uh, if he or she if your patient have some allergy with that product, you should stop using
Mm-hmm.
that product. But I don't have any experience about the allergy with this product.
Okay. And Dr. Ayuni, related to the previous question, asked PDR and salmon DNA is safe for patients who have an allergic. You already answered it. How about it's correlated to patient who has allergic to fish?
Fish?
Yeah,
It's
no, not
it's
related.
not. It's not. PDRN is from salmon,
Mm-hmm.
but PDRN is not protein.
Oh,
It's
not contain the protein.
yeah,
Okay.
it's not protein. It's a fragment of DNA. So it will not make any allergic problem like from fishy.
Mm-hmm.
So if he or she if he or she has allergy with fish, it doesn't matter.
Okay.
It's not related.
Oh, yes. Dr. Jade Natania asked, which would you prefer? Derma stamp, derma roller,
Huh?
or derma pen? Which one?
What was your question?
Which would you prefer to use?
I would like actually I prefer use derma stamp.
Okay.
Derma stamp, but I heard that in Indonesia it is hard to get a derma stamp. Derma stamp. It's easy to get a derma roller, so I prepared a demonstration with derma roller.
But it's okay if we use the stamp roller or pen.
Yes, yes. But I prefer to use the derma stamp.
Okay.
Yeah. And I'm gonna prepare the next.
You just have 2 minutes left
2
for
minutes. Okay.
yeah.
Okay.
Because the time is up. Dr. Tias asked, let me just read it quickly. How deep when you use the MTS method using Dermapen? I think it's already answered by Dr. Kim.
Yes. Less
Dr.
than
Maria,
0.5.
yeah. Dr. Maria Angelina, Dr. Kim, how about post-acne scar regimen? How deep should, it's already answered also.
Yes, same.
Yeah, possible to use the pdrn by injecting directly intradermally. Is the first question is already answered.
Yes.
The next question from Dr. Tias: how deep you hit active acne using Derma pen is in order to avoid hyperpigmentation. How deep?
For acne.
How deep? Yes. Dr. Tiasmin, maybe.
Yeah, I use only 0.25 or 0.5 millimeter deep roller. Yeah, but you can. But to summarize, not to make bleeding is very important. But if you use MTS on acne area, you can make bleeding a little bit, but that's okay. Yeah.
Yes. And the endpoint is just erythema.
Yes, just erythema is the end point. That's correct.
Okay, Dr. Bear asked, it's okay to do MTS to patient with keloid history. Keloid
history. Yes, it's okay. Because if he or she has keloid, it is not on her or his face. Keloids always occur out of face, and if he has a keloid on the neck or some area, but I think MTS does not affect to keloid. So if he or she has keloid, it is okay to use MTS.
Okay. And it's safe for pregnant and nursing women?
Actually, it does not affect to a pregnant woman, but I don't recommend it to any procedure to pregnant woman.
Yeah. Yes.
Any procedure. Yeah.
And for the uncontrolled diabetic patient?
Yeah, it doesn't matter. It doesn't matter. Yeah, it's very light procedure. Yes. So yeah.
Dr. Kim, I'm afraid we are running out of time.
Yeah.
It's time to conclude your presentation. Thank you for interesting. I think the most of participants is you become the favorite today.
Okay, thank you.
Thank you for being here and stay healthy and safe. Yeah. Okay, thank you. Bye-bye.
Yeah, thank you. Yeah, bye-bye. I want to meet you face to face next year.
Oh, I hope so. Inshallah.
Yeah.
Bye-bye.
Thank you very much. Bye-bye.
Yes,
thank you.
Bye-bye. Thank you. Now it's time for us to break. You can also check the networking lounge from lobby at web, and then we can discuss more about everything related to all topics from day one. Don't forget to join our next session in the same room at 14 p.m. or 2 hours from now. See you again soon. Have a great day. Wassalamualaikum warahmatullahi wabarakatuh.